Grace and peace. Welcome to Judah's Roar Domestic Violence Awareness Initiative YouTube channel. I am your host, Apostle Cheryl. Now listen, before we get started, as we do every week, I want you to take a few seconds and check down here below the video. Make sure you subscribe if you've not done so already, and then click the bell for notifications. And that way you'll receive a notice every time we upload a new video, usually Sunday evenings at 4 p.m. Central Standard Time. Now listen, if you get a notice from us and you're not able to join us in the live chat, then go ahead and share the video as soon as you get the link, and then come back when you are able at your earliest convenience, and feel free to view the video at that time. Now we have 140 plus videos uploaded on the channel here, and so it is our hope and our prayer that there is something here that will help you as you endeavor to educate yourself, refresh your memory regarding domestic violence and how you can best manage it. All right. And so don't forget to share the video even as you're viewing the video. And also don't forget to give us a thumbs up. Make sure you like the video. Okay. Now, we have embarked on a new series about depression, because depression and domestic violence are intertwined. They're so intertwined that if you have domestic violence taking place, depression is also taking place, okay? And so this is segment number 2 of our series about depression. In segment 1, we talked about depression, sadness, and grief. What is the difference? That was segment 1. This segment will address the risk factors, the things that make us vulnerable to experiencing depression in our lives. And now listen, if you haven't had an opportunity to listen to segment 1, I encourage you to go back and listen to segment 1 also. So make sure that you are tracking with us, okay? All right, so I'm going to share some facts with you that I didn't mention in segment 1, just in case you've not already viewed segment 1. According to the World Health Organization, depression affects more than 264 million people. 264 million people worldwide, okay? And it is one of the most common mental health conditions. So although there tends to be a stigma, not only in the United States, but around the world regarding mental illness and mental health conditions, I think there's less stigma than there was when I first entered the field over 30 years ago. I think there's a greater understanding, but I think there's more that we need to learn so that we can interact with others in a compassionate, empathic manner. So 264 million people worldwide are affected by it. We talked about the fact that there are several different kinds of depression, and each kind has its own set of symptoms. All right. We've already discussed the fact that sadness and grief are not the same thing as depression, but when they are prolonged, they can lead to kind of morph into a depressive state. Risk factors. What are some of the things that can be present in our life that will predispose us, make us especially vulnerable to experiencing depression later in life? Okay, so a family history of mood disorders. So if you have a family history of mental illness, of mental health conditions, of depression, of anxiety, of bipolar disorder, of any mental illness, then you are predisposed to experiencing depression. So that's something that you want to keep in mind. If a parent or a sibling or some family member has struggled with a mental health condition, that could make you more vulnerable. Okay, so that's one of the risk factors. Another risk factor would be a major life change. It could be the loss of a loved one. It could be the loss of a pet. It could be the loss of a relationship, a friendship, a fractured relationship with a childhood friend, or a fractured relationship with someone that you once enjoyed a close relationship with. It could be a romantic relationship. It doesn't have to be, okay? But a major life change. Maybe you've lost your home, or you've lost your job, or you've relocated and you've moved away from your support system. Okay, so these are things also that could predispose you to experiencing depression. Trauma or chronic stress. If you have some awful thing happen to you, if you are a domestic violence victim and you're in a relationship with ongoing toxicity and ongoing abuse, this could absolutely predispose you to dealing with depression. Chronic stress is another risk factor. So, again, going back to domestic violence, that's chronic, ongoing, seemingly never ending stress, right? If you're not in the throes of being actively mistreated, you are on pins and needles about when is it going to circle back around again, because you know that it will. And so, ongoing stress at work, uh, stress regarding how you're going to make ends meet, or how you're going to pay your house note, how are you going to pay your rent, how are you going to pay your car note, um, stress regarding expectations for you from a spiritual standpoint. Maybe you have assignments that have been given to you by your ministry leaders and you don't know how you're going to get those done. And so stress, ongoing stress where it appears that there's no break, no end in sight. Okay. Also, medical conditions. There are medical conditions that can absolutely impact our mood. If you get a diagnostic test done and the results come back and they don't appear to be in your favor, or if your doctor gives you a less than glowing prognosis for an illness that you have been dealing with, or you've received a terminal diagnosis, or you're dealing with a chronic illness. Maybe you're diabetic and you're constantly struggle to maintain, your weight and your blood sugar level, or maybe you have issues with blood pressure. Okay, and we know that stress can also exacerbate that. And so, a medical condition can also, sometimes the medications that we are prescribed to deal with certain medical conditions can also trigger depression in us. Okay, and so that's another risk factor. um, Alcohol or other substance use, no matter what your substance of choice is, it's impacting your mood, because come on, let's be real, if it didn't impact a mood somehow, we wouldn't do it. The issue with alcohol is this, that it is a central nervous system depressant, and so if you're dealing with depression, consuming alcohol will absolutely make that worse. Okay. Mild cases of depression respond well to talk therapy, and having a really good, solid, compassionate support system that will also hold you, accountable for doing those things that you need to do to feel better. Diet and exercise are a great place to start if you're struggling with depression and you feel it coming on. Keeping your body moving, keeping your body active. For me personally, it's kickboxing. I absolutely love kickboxing. It's an amazing full body workout. It's a great way to relieve stress, and it helps me. Um, Even now, 3 to 4 times a week, I kickbox 12 rounds with a heavy bag and gloves. Yes, I do. And I'm telling you, it works wonders. And so typically every other day, no longer than every 2 days, I'll make sure I get a session in, because it helps me to stay centered and happy, um, and positive and forward thinking in my thought processes. Okay. Um, and then also, if you are dealing with depression and you have been diagnosed as depressed by a mental health professional, and then prescribed medications, there's a lot of stigma around medication. And I want you to understand that often we can be depressed for so long that it depletes our chemical balance, literally, in our brain. Okay. And we need our brain to function properly so that we can make appropriate choices and make appropriate decisions. And so it's okay to take medication as prescribed. And it's also okay to let your medical professional know, your psychiatric professional know, if the medication's not working or if it seems to be making things worse or whatever. Okay. You want to advocate for yourself. Always, 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 always. If it's not working, say it's not working. Don't you, and this is what I used to tell my patients in inpatient facilities. that I helped to establish, in counseling groups that I've done. Listen, if the medication's not working, don't you modify the dosage. Don't do that. If the doctor said take one pill, you take one pill and give it time to work. Ask them how long should it take for me to begin to feel better, so that you have some kind of idea of a timeline. It might be 2, 3, 4 weeks. Okay. Give it that amount of time. And if it's not working, speak up and say something. Look, this is not working for me. Don't you decide, well, I'm not going to just take one because one's not working. I'm going to take two. Two things will happen. Number one, it might be too much. Number two, the best choice may be to change medications altogether. Number three, if they gave you a 30-day supply, you're going to run out of meds in about 2 weeks, and then you're not going to have anything at all. So advocate for yourself, okay? What do I want you to take away from this video? I want you to understand the risk factors, the things that make us vulnerable to dealing with depression, a family history of it, having experienced childhood abuse, sexual assault, a traumatic event, a medical condition. So there are so many things that can cause us to start down this road. And what's important is that you understand that there is hope. That depression is not the same as feeling a little sad. It's not the same thing as being a little discouraged. It's not even the same thing as grief. Okay. It is very pervasive. It tends to permeate every corner of our lives when it's an issue, and it affects everything. It colors how we view the world. It definitely impacts what we believe our options are in terms of bettering our situation or bettering our circumstances. It will cause you to feel disempowered, and to not be able to view things clearly. And so a support system is absolutely recommended. Someone that's going to be supportive of you, but someone who's going to hold you accountable for doing those things that need to be done in order to improve how you are feeling in your day-to-day life. Okay. All right. So we've been talking about risk factors. It's our prayer that this video has been helpful to you. Again, again, there is life after abuse. There is hope after you've experienced egregious, horrible treatment in a relationship by someone that you trusted with your life and with your heart. Um, and we want you to know that. We want you to know that we know from personal experience that there is absolutely hope. There's absolutely hope after abuse. There is absolutely hope when you are ensnared in the throes of depression. All right. There absolutely is. I'm telling you what I know. All right. And you can experience joy and peace in your life. This is Apostle Cheryl with Judah's Word Domestic Violence Awareness Initiative. It's our hope that this video has been helpful to you. If you're having any thoughts of self-harm, if you have a plan to harm yourself, and if you have the means to harm yourself, if any of those three things apply to you, please, please, please reach out for help. Call 911. Call your mental health professional. Call the emergency room at your local hospital. Reach out to the suicide prevention line, okay? Reach out to domesticshelters.org or the hotline. But if you are feeling hopeless, I want you to know that you can't trust that feeling, that there absolutely is hope. Your life can get better, and you can have the power to make it so. Blessings to you.